How biostatistics powers public health. Biostatistics is the backbone of public health. It gives us the tools to collect, analyze, and interpret data, helping us understand not just what is happening, but why it's happening. By analyzing patterns, biostatistics helps us draw meaningful conclusions, make predictions about entire populations from small samples, and account for uncertainty, a critical part of every public health decision. Understanding health behaviors. Biostatist helps public health researchers study behaviors like diet, physical activity, smoking, alcohol use, and seatbelt habits. Surveys like the Behavioral Risk Factor Surveillance System (BRFS) collect this information, but it's biostatistics that turns it into actionable insights. It reveals connections between behaviors and outcomes, like how smoking or high cholesterol are linked to heart disease. It also powers research in the social and behavioral sciences, helping us build models that explain why people make the health choices they do, and how we can influence better outcomes. Biostatistics measures the real impact of health interventions too, showing whether changes are truly significant or just due to chance. It characterizes study populations, analyzes exposures and outcomes, and brings clarity to complex human behaviors. Understanding environmental factors. Biostatistics plays a critical role in environmental health research. It helps us calculate the risks associated with exposure to chemicals and pollutants, quantify environmental dangers, and determine how much exposure is too much. Modern technologies, like genomics and environmental sensors, generate massive amounts of data. Biostatistics and bioinformatics provide the sophisticated methods needed to uncover hidden patterns and link exposures to diseases. Using spatial statistics, public health teams map environmental risks, spotting clusters, hotspots, and connections between where people live, what they're exposed to, and how it affects their health. Biostatistics supports ongoing surveillance, risk assessments, policy development, and evaluates the success of environmental interventions. It also helps researchers understand how environmental risks interact with other factors like genetics, culture, or socioeconomic status to shape health outcomes. The big picture. At its core, biostatistics gives public health professionals the power to describe patterns, test theories, measure risks, and evaluate solutions. Without it, we couldn't make sense of the complex relationships between behavior, environment, and health. Biostatistics doesn't just support public health, it drives it forward.